So, Dr. Phillipson, what is ERP for responsibility OCD?
There's a subset of OCD where patients are interestingly not concerned about their own physical well-being in terms of contamination,
Okay.
but they're concerned for the welfare of others.
Okay.
And it's interesting because the contamination might involve something like a sickness. So if I touch the pole on the subway, which I have no qualms about, if I had this form of OCD, I would wash my hands because I then wouldn't want anyone else to be innocently exposed to what my brain says are these horrible New York City germs,
Right.
which I don't agree with. But many people see New York City as the bastion of evil germiness, mostly tourists, however. So in this regard, this is where a patient will develop a hierarchy, but will be willing to expose others, innocent others, or even family members,
Right.
to what their brain tells them is contaminated.
Right.
Now, the interesting component of this type of OCD is that it involves both the anxiety threat of harming others,
Right.
but more importantly, and even sometimes more difficult to treat, is the guilt component, or what also can be the character assassination component. What kind of a callous, person would I be to make my family sick or to give sickness to an innocent other?
Right.
And so the idea of, the guilt of causing harm to others, or the character indictment of saying, I'm a callous, negligent person that who could ever harm others. This component can be an added layer of difficulty for many patients who, often say, sure, I would be willing to deep dive into the city subway pole.
I'll put myself in harm's way,
way.
but I can't ever imagine doing something that could even potentially risk the well-being of my beloved other people in my life.
Or innocent others.
Or innocent others that I don't even know.
Exactly.
Yeah.
And so in this regard, you really have to be sensitive to both components of the anxiety and the guilt.
Right.
Later, we'll talk about the different types of emotions that can come with OCD. There are about at least top 6, and there are other even more peripheral emotions that can come with OCD. But in this regard, the idea of putting others at risk is also something we work within a hierarchy toward.
Right.
And fortunately, when a patient is compliant and aggressive, they get the same, biochemical dividend, neurological dividend that pays for any type of exposure work. But in this regard, it can be a little bit more of a slog because of those the additional emotional component.
Right.